Good afternoon. It's a very homely atmosphere. All अपने यूपी के लोग हैं, तो I'm more comfortable. So I'll be talking about the new menace we are facing. That's diabetic retinopathy, and as we all know, that the, it is going to touch about 100 million very soon, and we have a huge shortage. I don't know. We have a huge shortage of retina specialists, especially in the periphery, especially where the rural population has a very poor compliance. We have got an array of recent advances in diagnosis, in management. We have all sorts of anti-VEGFs, all sorts of advances in anti-VEGF. But what is the need of the hour? The need is that we should focus on low-cost modifying factors, which has not been explored yet, especially in the Indian scenario. Okay. One very interesting thing was that came recently was the gene therapy and genetic research. So I will just share my researches and what I am planning to do in the next few years, and what we should think about how to manage it in a more economic way with the facility in our country. Okay. This was one of the theses where we found that in diabetic retinopathy there was two types of polymorphism, namely minus 374 TA and minus 429 TC. These were the procedure how we basically located these polymorphisms. Okay. In the near future, if we have got a CRISPR technology and we can just cut that area of polymorphism, probably diabetic patients won't develop diabetic retinopathy. Okay. Another work which I did was on brain-derived neurotrophic factor. In diabetic retinopathy, basically we are focusing on the vascular aspect. We are not focusing on the neurological aspect. It's a neuropathy also. Okay. And we found that there is a huge shortage of BDNF in advanced diabetic retinopathy cases. That means if we treat the patient with with BDNF therapeutically, probably diabetic retinopathy is going to improve clinically. These were the statistical figures which collaborates that there is a low rate of BDNF in diabetic retinopathy advances as the stages advances. Other researches, I saw that this human retinal binding protein, which was a very good blood-based biomarker to test diabetic retinopathy. Okay. Some of the hormones, estrogen these are all my personal researches with my postgraduates. We saw that estrogen had a protective effect on diabetic retinopathy. That's why females up to 45 and 50 like that, they are protected by and then after that they develop it very fast actually. So it has got a protective effect. We can think of estrogen as a therapeutic agent also in the research. On the contrary, progesterone and cortisone, they were having the opposite effect. Okay. We all know that diabetic retinopathy and hypothyroidism both are autoimmune diseases, and they both go together. Okay. So I always tell my students and my patients, any patient of diabetes and diabetic retinopathy, get your thyroid level also checked. Okay. As I told, serum cortisol was very high with higher stages of diabetic retinopathy. Same was the case with bone turnover markers. That means huge amount of hypocalcemia was there in advances and advanced stages of diabetic retinopathy. Okay. These are some of the other studies I am going through, that is on epigenetics. And we found that one of the steps, that is DNA methylation, can be taken control of in managing diabetic retinopathy. I'm not going through the details. Some of the inflammatory marker very conclusive for retinopathy, that was TGF1 and ICAM, is going on. We all know the role of deep learning, AI, and telemedicine, nanotechnology, stem cell therapy. What I want to stress on this talk was on two things. One, recently we have found that it is the mitochondrial dysfunction, which is one of the main factor responsible for diabetic retinopathy. And along with antioxidant therapy, people are trying to find some mitochondria targeting antioxidants like MitoQ and like that. Okay. And there is a impact of microglia on the vascular units. They are thought to aggravate diabetic retinopathy. Okay. Very interesting thing I wanted to highlight again was the role of gut-retina axis. In India, we have got a very healthy food habits. We don't take junk foods, which goes with our Indian tradition. We take a lot of dahi and all. So it was now it is being basically postulated that if your gut is healthy, your retina will be healthy. I'm going to give the next thesis on this topic. Okay. These are the role of prebiotics and probiotics and how dietary intervention can improve our gut and eventually our retina. Lastly, the behavioral factor, a stress-free life, mindfulness. Yoga has a big role, but we have to find some evidence-based medicine to see the role of yoga and the different asanas on diabetes and diabetic retinopathy. Again, my another interest which of mine is the role of the connection of diabetic retinopathy with Alzheimer, because both are neuropathies, and literature have shown that with the advancement of diabetic retinopathy, people are having dementia, they are going through Alzheimer diseases. So once I did my thesis on BDNF, probably next I will try to correlate diabetic retinopathy and Alzheimer. Just imagine a patient who cannot see and cannot think or uses his memory. So this will be my future study. At the end, I would like to just stress upon that we have cutting edge technology, but I think we should utilize this cutting edge technology and amalgamate it with our Indian tradition and change in behavioral lifestyle. Thank you so much.
Very nice, Dr. Waris. One quick comment from Dr. Sandeep, who is sitting here, retina expert. Can you give the mic, please?
Yeah. जुड़ के आ जाए ऐसे. Because I have done about 12 to 14 topics on diabetic retinopathy itself. If I can just bring it together, sir. And I will take your help to her. You can suggest us, sir, कैसे करें इसको.
उसको linking अगर हो जाएगी तो बहुत अच्छा उसमें रहेगा.
Yesterday we did an IC on inflammation and neovascularization, and a lot of discussion was on diabetic retinopathy, and you were also talking something which is nearer to what we were talking. So I think there is a need to interact with each other within the state. Yeah, Dr. Parv.
Sir, when you say the gut health, it helps in controlling diabetic retinopathy.
No, there are good bacteria which like
So
that has got a retinal axis. There are literature, but I haven't worked on it.
Okay.
Probably I will just do both.
Maybe
with diabetic retinopathy and patients who are having probably chronic some elementary disease or something.
So is that general inflammation which if the gut is not healthy and if we give prebiotics, the gut becomes healthy. So does it reduce the general inflammation, which reduces the inflammation of the retina?
I'm not exactly clear how the gut is
It
related to
works.
retina,
We have to
but
find out.
literature are supporting it.
Okay.
Probably sir could add something, I don't know. Something. But I just remember,
for
just for
long-
the sake of discussion, पुराने जो हमारे वैद्य और हकीम कहते थे कि अगर आपका पेट साफ है तो 100 बीमारियां सब बचते हैं. There must have been some relation. Maybe sir will add something.
I think there has been a relation and ये जो आपके वैद्य लोग पहले त्रिफला तो हम लोग उतना यूज़ नहीं करते, बट वो तो आयुर्वेदिक का एक मेन फैक्टर है, and that is mainly focused on the gut health. So if we keep our gut well, things will be well. And the January issue of AIOS retina वाला जो issue है, so that has an article on this
Gut retina
gut
axis.
and the retina
Maybe
axis.
something to do with immunology or vascularity.
Yes, तो वहाँ से कुछ
वहाँ से
आपको
कुछ
और
मिलेगा.
और input
But I
मिल
will work
सकता है.
on it definitely. Thank you, sir.